Welcome, everyone. Today, I am very excited about this episode. I am joined by Dawson. Dawson is a former national champ in strongman, and he is also part owner of a new gym in Anna, Illinois called Rise Performance 618. So, Dawson, go ahead and introduce yourself.
For sure. My name's Dawson Montfort, as Colton said. I'm a strength and conditioning coach, and we just opened I like to call it probably the best strength and conditioning gym in all of Southern Illinois. Here in Anna, Illinois, we have every piece of equipment you could ask for. We do powerlifting, strongman. We really specialize in athlete development and youth S&C. So that's what we're doing right now. My history in sports, I played college football and college baseball. When I was done with that, I moved to work a job down in Texas. I was an engineer for General Motors. While I was down there, I was just fortunate to learn under Danny Rivera, train at Metroflex, the Castle with Randy De La Cruz, learned from just some really, really good strength conditioning coaches. And from that, I've kind of furthered my experience as a coach. I've become certified. I'm a CSCS, and I'm trying to bring some of that stuff back to Southern Illinois to try to help some of the youth athletes.
Absolutely. And for those of you listening, I've been out to the gym. It is absolutely amazing. What do you say, 11,000 square feet?
Yes.
It has batting cages. It has like 3,000 square feet of turf. It has strongman equipment, and it just has your general gym equipment as well. They're also partnering with athletes meal prepping out of Goreville. So they are selling meals out there as well. They have a lot of cool gear, so I encourage everyone to stop out there and check out their facility. So let's get to the nuts and bolts of this episode. Why do you encourage youth athletes to weight train?
Well, I think there's a general misconception from the older generation that weight training may stunt bone growth. So I remember hearing that actually from my dad as I grew up. You shouldn't weight train till you're an adult or you're in high school because you get yourself hurt. And that's just nonsense. There's been so much science to debunk that theory. It's ridiculous. In fact, it's proven that the child is more likely to get hurt playing soccer than they are weight training. It's just like anything else, you should look at a sport or anything as it is dangerous, and it needs to be taught appropriately. So I encourage youth athletes to get in the weight room. One, it teaches discipline. It teaches proper movement pattern if you have a good coach. And that's what we pride ourselves here on. We're not just meatheads trying to get kids to lift a lot of weight. We are movement specialists. Safety first, movement, and then the weight comes very last. So I encourage it. One, it teaches kids good habits at a young age. It teaches them self-control and discipline. And it's fun. I have so many kids that come out 8, 9, 10-year-old, and they've been with me for 6, 7, even up to 8 months now, and they love it. We get to lift weights, we push sleds, we make obstacle courses, we create a fun environment where exercise is fun, and exercise is fun. We get to use I like to call from Guy I learned from Andrew Triano, a really good strength and conditioning coach out west, is these are our skin suits. We get to wear these things around and get to play with them and figure out how to use them. So like our facility here with so much open space and things to do, go play with it, see what you can do, see what you can push and pull and move, and it's a beautiful thing, and kids coming in is really going to be a great. It's a really unique family environment in here, and still a hardcore gym at the same time, where we're actually we have squat bars and monoliths and all the things that you're supposed to have in a powerlifting gym, but yet there's 8, 9-year-olds walking around, and these 8, 9-year-olds know exactly how to load a barbell, and they know how to face a barbell, and they know if I tell them to overhead squat, back squat, front squat, overhead press, strict press, push press, power clean, they know exactly what to do. They're very competent in the gym. And to me, that's why it's important. As they get older, at some point, inevitably, you're to walk into a gym. So teach them at a young age how to do it correctly so they're not misinformed as they get older.
Yeah, and anyone who has seen Dawson in person, weights definitely haven't stunted his growth at all. He's a pretty large human being. And taking it back a little bit, especially for our rural area here in Southern Illinois, I think something like you guys are doing is extremely important, because where you're located, you have all these small schools with small budgets. So a lot of them don't have proper weight rooms in general, let alone a proper coach that they can, pay to work full time and work with the athletes and
Absolutely.
things like that. So most of the time, once the kids get up to high school, they may be just going to the local gym without any proper training or knowledge on how to lift. And then they have all these bad movement patterns. And me as a provider, I'm all about function and getting people to function throughout their daily life pain-free. So I love working with you guys because you don't start them off seeing how much they can PR. You're going to teach them how to move, how to lift, and how to go through these functional movement patterns the right way before you load it, because that's
Absolutely.
where we see a ton of injuries happen, is from over time loading bad movement patterns over and over and over again, and then you get confident and you throw a lot of weight and bam, you're in my office. So tell us a little bit about how you start these young athletes off. You're not signing them up and saying, okay, let's see what your PR is and then go from there, right? You're doing a little evaluation and setting them up for success.
Absolutely. I apologize for the noise in the background. That's somebody deadlifting. I am in a gym, so we get noises like that. But yeah, let's talk about starting off with the youth. No, we never come in and test them right off the bat. That's something I disagree with a lot, even on the high school level. You walk into a weight room your freshman year in athletics, and they usually run a program in small areas called Bigger, Faster, Stronger. And the first thing to do, let's get baseline strength numbers so we can base percentages. Well, you're not getting true baseline strength because the person doesn't even know how to move appropriately yet. So what we start every kid here with, I'm a big fan of Mark Ripetoe's teaching and starting strength. I've read every book he's produced. It's fantastic. I've seen it work in person. And so with every kid that comes in, we start with, let's figure out how to air squat. Can you lower your butt down to the ground, keep a neutral spine, and get yourself in good position? Once that is mastered, we move to a PVC pipe. A PVC pipe is usually our barbell for the first month, where you learn to do all the movements with no weight. Because again, doing the movements in itself will strengthen good movement patterns. Like I tell kids, a squat to depth with no weight will transverse to the field as an athlete or court, whatever sport it may be, much better than a quarter squat with a lot of weight. It is what it is.
Mm-hmm.
Like learn to move first.
Yep.
And the cool term I like to use with all my youth athletes, they have to earn their right to go up in weight. So say I've had them for 4 or 5 months, they're becoming more efficient, and every human wants to say, how much can I do? Well, that's where we really step in. And if they want to move up in weight, they have to show perfect, flawless form for 3 sets of 5 at a specific weight. And then they're allowed to go up 10 pounds on a squat or deadlift or 5 pounds on a press. And that's it. So they have to earn that right to move up in weight. And I tell them that all the time. And it's not just being able to do it efficiently. They have to make sure they have good etiquette. They have to unload the barbell. They have to put things up. They have to encourage the other people in their groups. So it's not just the movement we're teaching. We're teaching them how to be good athletes, good people, have good manners, be good teammates. And so for you to earn your right to move up in weight, you have to demonstrate all those in our gym.
I'm going to put you on the spot here because you're talking to me, you're on my podcast. Why do you think it's important for any athlete to have a sports chiropractor?
Absolutely. A person is only as good as the team he surrounds himself with. Inevitably in sports, in life, we're going to get injured. It's going to happen, but that does not mean it's a life sentence. And for me, in my personal experience, I have found that a sports-minded chiropractor that understands functional movement and that keeps himself abreast of the latest information has been the best thing for my body, because a lot of times we'll catch injury or catch movement things or whatever before it happens to be a big one, and then we can do injury prevention. So that's what it's all about. We don't want a person to get hurt. We want to prevent a person from getting hurt. So having someone that you see on a regular basis, like a good chiropractor such as yourself, that understands athletes, that understands the daily grind of what they're putting themselves into. And here's the big one. One of the big the greatest things about you never limit someone from doing something, right? Like if you want to be if you get a jacked up leg, if you want to squat for the rest of your life, that's because it's your life to live. absolutely, let's go out, let's figure out how to do it safely. And you always have a way to figure it out versus, oh, we just don't do that anymore, which you hear from a lot of general
Yeah.
practitioners or, the doctors that don't keep themselves up. So I think it is just like it's important to carry athletic tape in your bag or carry knee sleeves or elbow sleeves or a belt. You need to have a sports doctor that you're constantly in communication with and seeing on a regular basis. Don't wait for something to get hurt before you go to them. Go to them and say, hey, I noticed, my knee kind of comes in a little bit on my squat, and every once in a while my left hip hurts. And then it may not be bad, but talking to someone like you can go through some movement patterns like, all right, this is what you need to do. Here's some exercises, here's some stretches, and then you can incorporate that in your strength plan. And the athletes can come to me and say, hey, I saw Colton today, or I saw Dr. P, and he said, I got a little imbalance in my hip. Boom, let's figure it out. So then my accessory movements that we start doing in mobility exercises will reflect that. I mean, it's crazy not to have someone like you in your corner. It's just, we're lucky to have you in Southern Illinois. I think I've told you this before. I've competed all across the country and even up to the Arnold on the international level. And good athletes have a chiropractor that goes around with them. And I was fortunate enough to know a couple of them, Brian Arena, that Colton. And anytime I moved to a new area, I was like, Brian, who can I see in this area? And without hesitation, he told me you. And it's been a good relationship so far. You've helped me with my lower left hip and a little knee pain here and there, but now it's just regular maintenance to try to see every 2 weeks just to make sure I stay on top of stuff. And I recommend that to everybody. Don't wait for something to hurt to go to you. Like, find you, go to you, say, hey, I have a few things that I don't like whenever I move this way. And then you can give them a plan to help them move forward and have an even more awesome life.
Well, I appreciate all the kind words. I promise everyone I did not pay him to make a speech for me like that, but thanks. And I kind of want to build off of that from the doctor's standpoint. I try to tell a lot of people because, the public doesn't know what they don't know. So, when a lot of people think that if they've tried a chiropractor and it didn't work, then, just chiropractic care isn't going to work for them in general. And I tell everyone, you can go to 10 different chiropractors and you're going to have 10 different experiences, especially in our field of healthcare, because our scope of practice is so wide and there's so many specialties. Everyone has different techniques, different approaches, different thinking processes. So just because you've tried a chiropractor before doesn't mean, a different one's not going to work for you. That's why education is key. So when you are looking for someone to take care of you, you must research them.
Absolutely.
Is their approach, their philosophy matching up with the goals I'm trying to reach? So, for example, you being a strongman and competing and having pain with squatting, would it make more sense for you to come to me, who takes a lot of time with patients, looks at movement patterns, gets hands-on, still adjusts you, and then we also work on specific movements and stuff in sports oriented, or would it make sense to go to someone who's more traditional where they just see for a couple minutes and adjust you and, let the body do its own thing? I would like to think it's more beneficial to come to me as we've seen with the results. So everyone, the traditional style of chiropractic has its role with specific people, but you have to look at what your goals are. And does that practitioner match up to your goals? Are they practicing a way that's really going to be beneficial for you? So that's one thing I'm trying to do is I'm trying to bring a whole new wave of the chiropractic field to Southern Illinois, something that we don't see anywhere else. And that is spending a lot more time with our patients, because you cannot thoroughly evaluate a patient in 5 minutes. You can't do it. You can't do it. I don't care what anyone says, because if you do it the right way, you have to not only talk to them about the problem, you have to watch them move. You have to get hands-on. You have to not only adjust them, you have to address the muscles. You have to address stability, mobility, exercises. And then you have to set them up with the home care plan. And that takes time, because you need to really connect with them and let them know, what you do outside of my clinic is going to take you as far as you want, because you only see me say, 30 minutes once every 2 weeks, what are you doing the other 13 days of the week? Things like that. So, and that goes for anything. If you want to go to a dietitian, you need to research how they approach diets and how they evaluate people, because maybe they specialize in diabetes. And so, but you're wanting to bulk up in the gym, is that dietitian going to be beneficial for you, or should you find someone who works with strength athletes? So always research where you're going. Don't give up after something doesn't work the first time, because keep searching, you'll find someone to help you. So what's your favorite lift?
Well, right now, personally, I'd say I'm more of a veteran strength athlete now. I've been doing it for several years. So, the presses are a lot easier on my body now. So I really enjoy the overhead. I like old movements. It's like kind of like the strength sports. I like old things and things that have some history to it. So I'm a really big fan of the strict press. Mark Rippetoe made that famous, but the strict press is a very old movement type of press. It's a leg drive overhead press. And that's probably my favorite right now. As far as like for my athletes and what's the most important, I definitely say the squat is the most difficult to learn, but the most carryover once you do learn. The leg strength it develops and the hip mobility and the ability to learn to use the stretch reflex from the hamstrings. And I think it's got probably the best carryover to sport, but closely followed to the deadlift. The deadlift is the ultimate posterior chain builder. And if done correctly, it's just a very safe lift. It gets a lot of bad rap from can hurt your back. Well, it's just because they're performing it wrong. But the deadlifts tends to be the favorite of my youth athletes after they learn it. And especially the high school athletes, it's the most efficient way to move the most amount of weight. They feel good after doing it. So if performed correctly, the deadlift is very safe. But hard for me to tell personally. Strict press, first place for everybody else, probably learning a good, proper squat. I lean towards a low bar squat versus a high bar squat because the building of the posterior chain using the hips and the glutes a little bit more. But it's everyone has different anthropology, and I never have a dogmatic approach to where I think an athlete, there's only one way to squat. If someone squats really well high bar, they squat really well high bar. If they squat really well with wide feet and the bar path's right, back looks good, then why not? There's never one approach to a movement, in my opinion.
You're really beating me to all my topics today.
I'm sorry.
Answering them all right now. No, I like it. So I was going to bring up, I started laughing because you brought up the deadlift. And this is one of the biggest eye rollers for me as a provider, is when I hear other providers tell people deadlifts are bad, quit deadlifting. You're just going to not be able to walk when you're 60, things like that. And it's just like, that's the farthest thing from the truth. And here's why. Deadlifting is a daily basic movement. Your body has to deadlift. Your body is designed to deadlift. Guess what you're doing when you bend over to pick up the laundry out of the floor? That's a deadlift. Just because you don't have a barbell with 300 pounds on it does not mean you're not deadlifting. Bending over to pick up shoes, bending over to pick up your kid, that's a deadlift. Guess why a lot of people have low back pain when they bend over to pick up their kids and stuff? Because they don't know how to deadlift. They don't know how to move that way. And their back is not trained to stabilize in that position, properly move and all that stuff. So deadlifts are not bad. They are bad if you don't know what you're doing over time. But if you have bad movement for a couple times in the gym, and it's not going to destroy you. But if you do it for 20 years, and you're just not taking care of your body, anything can be bad in the wrong amount, right? Water can be bad in the wrong amount.
Dose makes the poison.
Yeah. So deadlifting is not bad. And I love hearing that from you too, because that's like the biggest eye roller for me. Typically when someone doesn't know what's going on with the patient, then they will say, just quit doing it. Right. You've probably heard that. And just quit doing it. It's causing you pain. And I have patients come in all the time and they're like, man, I strained my pec bench pressing, and I was told to just don't bench press anymore. I'm like, how about this? How about you see me twice and then you're going to be bench pressing better than you've ever done? And it happens. And it's just because they came to the right place at the right time. Now, I want to transition to another topic me and you both love and both agree on is barefoot lifting. I'm going to
Love it.
talk more of the specifics and the clinical side of it, but from your standpoint as a strength and conditioning athlete, tell me why you like it for everyone.
Well, it's usually the first thing I do whenever I get new athletes in the gym and we're learning to squat. I take their shoes off of them. A couple reasons. One reason, usually the shoes that people wear aren't designed to lift in. They're soft. They're kind of designed to propel you forward, more of a run. So you're going to be more amped to like geared towards the front part of your foot. We don't want to squat on the front parts of our foot. We want a whole foot to grab. And then two, it helps me see movement a little bit better. So like if the shoes are off and I'm watching them squat and I see some pronation out of the knee, I can see an arch collapse. Like, okay, I can fix that. Or like and then usually whenever I get the kids to squat barefoot over time, they learn to use their feet and their toes grab their heels, their whole foot's nicely planted to the ground, and they have a nice firm, it forces a nice firm arch, and they're pushing against a harder object. You know, I tell people, think about like trying to bench press and you have a big pad on your hand and make it kind of hard. You have more resistance to go against. It's the same when you squat. If you have a harder object to push against, it's just going to push a little bit more free. And so the barefoot, I think, one, it helps align the feet to move a little bit better. But I've learned from my many years in getting hurt and strength athletes that whenever my knee hurts, it's usually from above or below the knee. So if we can get the feet right, it usually makes the knee right. And if we get the knee right, it usually makes the hip right. It all starts from the thing that connects us to the ground. And if you think about it, everything that we do it starts with our feet. It's what connects us to the world. It's what connects us to force. It's how we produce force. It's all transverse right through our feet. So having the entire foot planted and firmly grabbing into the ground is very, very important to produce force, which is what lifting is. So I love barefoot lifting. I do it myself. In fact, I take off my socks because I like the more skin and impact I have against the ground, the better. Colton actually helped emphasize that for me, and I was dealing with a little bit of injury. And since then, I've hit some nice PRs on my squat. I'm squatting pain-free again. So there's a lot of benefits to the barefoot squatting or barefoot lifting in general.
Absolutely. Now, I'm going to take it a little deeper here. Do you say something? Mm-hmm. Oh, okay. I'm going to take it a little deeper here. So from the clinical side, barefoot lifting is very important for a couple reasons. So the palms of your hand and the palms of your feet have a lot of receptors in it, which, feeds your brain information about your environment. So if you touch something, you're feeding your brain with information, which is really important for your development. And it's very important for just your overall well-being when your brain is getting all this feedback. There's a reason why the palms of your feet and the palms of your hands are very sensitive. Now, when you're barefoot lifting, you're giving the brain all of the feedback from the ground and from the lift and everything. So you're really challenging the central nervous system, which is made up of your brain and your spinal cord. It's key that information is sent back up to your brain so your brain can learn. Now, on top of that, barefoot lifting is very important because the intrinsic muscles of your foot, the small muscles, are able to activate and they're able to do their job. When your foot is smashed in a shoe, it's kind of like taking something that's really tight and just like letting go of it. Like there's nothing there to help stabilize the bones of your feet, the arch of your foot, things like that. So it really activates and strengthens the intrinsic muscles of your feet, which is going to help upstream. It's going to help stabilize every part of your lower extremity as well, because if your foot's stable, then everything else, can work to be stable and move right and things like that. So you don't want to make the intrinsic muscles of your feet weak, and you also don't want to rob your brain of information from your environment. So that's even more reason to lift barefoot. Okay, so next topic I want to talk about is you see a lot of people with belts on, right? But a lot of people don't actually know what they should be using the belt for. A lot of people think that they're trying to decrease their waist size and decrease how much their stomach sticks out with this belt, and it's going to protect their low back. However, I strongly disagree with that. Research strongly disagrees with that. And it's more of, from my opinion and research, it's more of a mental cue. And
Absolutely.
you've used this term for your athletes, fill the cylinder. Okay. So it's a cue to push your gut, kind of have that force out, pushing a full 360 around the belt out. Because if you have that, I call it a keg, instead of a six pack, you got a keg down there. It's going to help protect that lumbar spine, the low back. It's going to help activate all those muscles. Now, the six pack does not mean you have a strong core. Six pack is one muscle, the rectus abdominis. That's one muscle. That's just for looks, essentially. And so when you strengthen all of the muscles around the abdomen and the low back, and you use that belt as a cue to explode through, that's when you're safely lifting heavy weight. Would you agree?
Absolutely. I get this all the time. They'll say, like, I have a high school athlete right now, he's a junior. Supposedly has some potential to move to the next level to play football. And we're going over some technique and stuff. And like we talked about, he hasn't been taught the right way in a few things. And I said, do you have a belt? He said, no, I've never worn one before. I heard they hurt you. I said, why would you think they hurt you? And I get this a lot. There's just so much dogma in the gym of unsanctioned, unscientific based understanding because they heard it from someone's uncle that lifted one time in their life and they don't understand what they're even talking about. And they'll say, oh, the lifting belt hurts you. It makes your core weaker. Well, absolutely not. I would disagree. Let's think about that for a second. But what I tell my kids, and because I teach them to use the belt, just like we teach a lift, we have a whole session on wearing a belt. And the first thing I say is this belt doesn't do anything to protect your back. It's just wearing a belt itself doesn't do anything to protect your back. It's how you use the belt. It is a tool. So just like you said, I call it a neurofeedback. As when we teach breathing and bracing, that's also a fundamental movement. We spend usually 3 to 4 sessions on how to brace. That's kind of a weird thing, right? Take a big belly breath and push out your abs. Yep. Okay, that's weird. Well, how do you create? And then we start teaching them why. But the belt just helps with that neurofeedback because when you do create a brace, boom, you feel the tension immediately. And so what I do is I put 2 fingers in between the belt and their stomach, belt around the sides and in the back, and I'll say, I need you to break my fingers off with this belt whenever you brace, so you create the tension. And so the kid will do that and they understand. It's like, all right, now the brain understands when I'm fully braced. Just like you said, it's a tool for the brain. It's that neurofeedback to know when the brace is happening. So that's what a belt does. It's very useful. It doesn't make your abs weaker, in my opinion. We can talk about that. We can break that down. But to me, if you're pushing against an external resistance, you could potentially say it makes your abs stronger. But for anything, it just teaches you how to brace. And I start them really, really young on how to properly use a belt. Because like anything else, it's a learned skill to use it. And there's so much misconception. I have had people lifting for 20 years that's never used a belt and they're scared to squat and their back always hurts, or they don't know how to brace appropriately. And that's a tool to use. Absolutely have it in your gym bag, and it doesn't hurt you, but you need to learn how to use it appropriately.
Mm-hmm. Yeah, and those people that come into the gym and they're scared to do movements, and so they haven't really worked out or done any of these lifts. Typically, that's the reason why their low back hurts, is because they're not moving. Literally, sitting all the time, not moving, creates more pain than moving and lifting. Like, that's just a fact. So you have to get the people mentally right too. And I kind of want to transition to that and use you as an example. You've had a couple major injuries, like you said, total knee reconstruction, and then you've also had a pretty nasty back injury, which took you a little bit to get over.
Yep.
And which initially brought you to me. And what did we do? What was it? Probably 2 or 3 sessions in, and you're like, I'm feeling good, but I'm still feeling this little twinge at the bottom of my squat or something. What did I tell you?
You told me I was fine and I need to fill the cylinder and go. You pretty much gave me confidence again of like, I've been injured multiple times in multiple sports. I ruined a baseball career over an injury because I couldn't get past it mentally. And I think that's a whole other podcast discussion on mental health for athletes and overcoming an injury. But a lot of the times, an injury does so much more to you mentally than you give it credit for. And you get hurt once and you say, screw that thing, I'm never going to do that movement again, because I was hurt once. Your brain remembers it and it wants to protect you. And so when I came to you after we started working on things, I had some hip internal rotation issues from the back, but we fixed most of it. And I was like, I just feel, bad at the bottom of the hole sometimes, and more of anything, I was just scared and nervous. And you pretty much said, you're okay, big cylinder, or get your brace and then just do it. And I started doing that and boom, no pain. So I think what you're getting at there too is just like the mental side of overcoming an injury and getting past that is tough. And we don't talk about that a lot, especially to our athletes or anybody in general. But I think that's, like I said, that could be a whole other rabbit hole discussion of mental health of athletes if we wanted to make it that one.
We should do a podcast on that, because like you said, we could probably talk about 2 hours on that. But from the mental side of pain, that's where in physical medicine today, we're seeing a lot of people mess up and sometimes make patients worse and not have good outcomes, because they are only treating the biological, the physical injury. So, like for you, you had no clinical indication. You gave me no reason to worry or order any imaging or anything. And the only thing that was holding you back was the mental side of your injury. Well, guess what? If you went somewhere that they don't really pay attention to the mental side, you probably today would still be feeling that twinge or whatever, and you'd still be worried about it. Well, in physical medicine, you can't just treat the body. You got to treat the mind too. You do. And that's why I truly believe we're seeing outcomes about 50 to 75% faster than most other clinics, because we're not just focusing on the pain. We got to focus on movement and the mental aspect as well. And that's a really hot topic right now in physical medicine, is the biopsychosocial model, where you're addressing the social aspect of an injury, the psychological aspect of an injury, and then of course the biological or the physical part of the injury as well. And that's also why you see some great professional athletes that are, the next big thing, and then they have this serious injury and they're never the same. Yes, maybe the physical aspect has kept them from being the same, but there's also a mental aspect. Think about it this way. Gordon Hayward, when he had that big contract with the Celtics, and then we all know that gruesome ankle dislocation. Now, he's not the guy he was when he played for Butler and the Utah Jazz. Derrick Rose, MVP, and then he tears his ACL, and now, he's just floating around out there. There's an exception like Adrian Peterson that tears his ACL, then runs for 2,000 yards the next year. So, there's exceptions, but for the most part, you see these people that have these traumatic injuries and they're really never the same. And I think that is a failure on the healthcare system, because there's no reason why they couldn't come back and be confident in their abilities, no matter what kind of injury they suffered. So earlier you mentioned on the squat, there's no cookie cutter approach to lifts. Yes, there is, I guess, ideally a perfect way to do each movement. However, not everyone is built the same. Not everyone weighs the same, is the same height, same arm length, leg length, same mentality, things like that. So trying to fit someone into this textbook lift sometimes isn't the best approach, right? You got to find out what's comfortable for them, what's pain-free for them, and then load these movements. What do you got to add to that?
Sorry, I just had a little gym snafu. Our 24-hour door is not working right now. So can you repeat the question, please?
Yeah, no problem. So earlier you mentioned like spreading people's feet out for squats and just kind of adjusting how they move. And where I was going with that is, when you try to fit people into this perfect, ideal way of moving, it doesn't always work, because not everyone's built the same. Not everyone developed the same. Not everyone weighs the same height, same whatever. So you have to figure out how their body moves comfortably, functionally, pain-free, things like that. And then you load it. There's nothing wrong with not having the absolute perfect way of moving. Function is more important than structure, in my opinion, when it comes to the gym.
So I have a couple rules that I always go by, like to make it really simple. So let's talk about the squat, for instance. There's a lot of people that are very, what we like to use dogma, but you'll see that a lot in this S&C world. Like the only way to squat's the low bar, or the only way to squat's high bar, or the only way to squat's an upright chest or low chest or whatever. And to me, like you said, like anthropology changes from person to person. So what I look for, there are two main cues. Can the person reach depth? Does the back stay neutral? And what does the bar path look like? So bar path to me is, or bar path is essentially if you drew a straight line if you're looking from the side of a barbell, if you're watching a squatter from the side, and if you drew a straight line from the center of the cap down, it should stay linear. It should go straight up and straight down, or a slight variance, but should stay over the middle of the foot, meaning it's in the middle of the body. If that bar starts to float in front of the toes, well, you have a problem there, because now look at from a mechanical disadvantage, where's that load go to? It goes right to your lower spine. It's like a fishing pole at that point. So I look for, if I can correct all those things, I don't care how the person squats. If he can hit depth, the bar stays loaded over center of body. So we have all the bones and all the structures properly stacked in line. And then he comes up smooth and even. So like there's no like knee valgus or a knee flaring in real bad, or hip shifting to one side or another. If all those things are met, I don't care how the person squats. If it's 8 inches down his back or right on top of his neck and he feels comfortable and he's moving the bar nice and even, and then if he meets those criteria, then he can squat that way. Deadlift, same thing. Some people like a real high hip hinge. Some people like to get really low hip hinge. What I look for, does the bar stay connected to the shins and drag up the body, or does it float out in front of them? Are they able to engage their back and keep a nice neutral spine, or does it round? If it starts rounding under load, well, we got a little bit of an issue there. Now, some people, there's some stuff there. There's some people that actually start with a slight rounded thoracic spine, but as the weight goes up, it doesn't change direction. You can argue that that's okay. I've seen a lot of major deadlifters do that for a long time and they're fine. So it's not always like you have to have a completely flat back. It's just, are you watching the spine move as the load is moving up the body? So like I said, I have like a checklist, if you will. Like I need these 3 things to be met, and however you need to meet them with your anthropology, like that's what's going to work. And it takes time to figure that out, especially for the young ones. It takes us 6 months to learn how to squat sometimes, and that's okay. Some people learn a little faster than others, and some people don't. And again, that's just fine. But again, we have to there's certain criteria that I want to meet to make sure safety of the barbell and safety of the movement's happening. And that's essentially bar path, neutral spine, good brace, and everything looks balanced and even. If we can meet those in a test, usually they're going to be okay.
I want to wrap up with how Southern Spine and Rise are working together. We've been developing some different ways we can work together, but I think most importantly, it is the co-management of your athletes. You guys, like you said, you screen them, you go through some different things with them initially, and if you see something where they need a little more attention, you send them to me. I evaluate, treat them, and then I send them back to you. And it's a co-management thing. And I think that really is the dream team for youth athletes, because my care and your training together are going to produce the best outcomes. So I'm really excited for that. And in my opinion, it's a no-brainer. If you're an athlete in Southern Illinois, you need to be a member of your gym and your training, and you need to be a patient here. And here's why, because here in a month and a half or so, I'm coming down the Rise, and we're going to go through screening athletes for injury or irregular movements or whatever it may be, where they need attention from a medical professional before training or during training. And so you guys are going to have the best evaluation system for the athletes. And then you're also going to have the best training system for the athletes because of the way you guys approach the training. So why, if your kid is an active athlete, why they wouldn't be in your gym is, beyond me. But we need to get as many athletes working with us, because we want Southern Illinois athletics to be next level. And it all starts on the off season. A lot of people like to wait till the season starts to get their body right, get their training going. And that is the wrong approach, and that's going to not set you up for success. So what do you got to add to that?
Sure. So two things. Let's talk about the impetus why I've actually started this, and we have something here that no one else has in the strength and conditioning world with youth athletes. I went to college to play ball, and I was not prepared at all to face the monsters that exist out in that world. And so after I've been in the strength world, I played sports in college, I did all this stuff. I look back and I was like, I just want to give our kids a fighting chance if they want to play at the next level. Give them the best chance possible so they can compete with the kids from Texas and the kids from these bigger cities that start doing this athletic development stuff at 7, 8, 9 years old. Like, those kids, their discipline, mindset, their knowledge, and everything that's been given to them, they're 10 years more mature physically and mentally at 19 years old than our kids are right now. And it is what it is. Granted, if you want to be a great high school athlete around here, great, let's do it. And there's nothing wrong with that. But for the few that have that dream and that heart of like, I want to take this as far as I can because I love this, man, you need to get on an S&C program, and you need to have a strong off season. You need to be working year round. You need to be playing multiple sports, and you need to have a good athletic minded chiropractor and a team behind you that's going to help you get there. We haven't had that, and now we do. And I think we're growing. I know I am. I know you are too, Cole. We're growing at a rapid rate. Like I'm bringing on new coaches now. And we've been open for a year out of my garage, but with the big facility, about 4 weeks, we're up to 180 members, and it's just growing rapidly because there's no one else that does this. I forgot there was something else I was wanting to say about that too. But just like you talked about, having a full team approach. It's not just about going to the gym or getting S&C or going to a chiropractor once a week. It's about having like what Colt and I are doing. We have a unique team environment where if your athlete comes to us, say if you're a parent, you want to bring your kids I want to make sure they're getting stronger, faster, they're enjoying it, and they're staying healthy. We approach it as a team. Like you said, if I have an athlete, let's take Rage Henderson I have a 10-year-old wrestling kid that's ranked top 10 in the world. He is an animal. But it was right during football. He plays youth football too. And he was lifting with me, and he kept complaining of a low back issue. So I know enough to screen. I don't know how to do anything corrective. That's where Colton gets. He's a doctor, right? I'm not a doctor. I only do strength conditioning. So when I noticed he had a little bit of a back injury, he had a football game this weekend, told his parents, said, hey, it may be nothing, it may be something, but let's get him in with our guy, Dr. P, and see what he has to do. Because the kid, I could tell on his face he was worried about it, because he knew he had a really tough football game against Cape Notre Dame coming up. And he was like, man, I don't know. And he plays a really hard position at fullback in youth tackle football leagues. And so we got him into Dr. P, and he looked at him, he was like, about everything. And he said, you know what, you're going to be fine this weekend. And just simply by doing that, the kid went off, had a wonderful game, but it gave him peace of mind. But now we know if we do have an issue, guess where they go? We go to Dr. Pedigo if they kind of meet for strength and conditioning. It's a collaborative approach for a full holistic strength conditioning and healthcare plan for our athletes. And that's something that's amazing to have. I wish I would have had this when I was a junior high school athlete. I wish I would have had someone to do this for me, but I don't. And now I can for other people. So bring your kids to us. We're to help you. Bring yourself to us. I got 80-year-old people right now that are squatting and deadlifting just fine, and they're not hurting their back. They're moving better than they've ever moved, and they're picking up and putting down heavy things. So it's all good.
Well, throughout this episode, I took a mental note about 15 topics. We got to make a podcast over, so we got some work to do for sure. They're all very informational. Those of you who are listening, please subscribe, like our show, leave a review. And before we get off of here, I just came up with an idea I did not discuss with Dawson, so I'm putting him on the spot again. For those who actually listen to the entire show, how about we do some kind of giveaway or drawing?
Sure, let's do it.
Okay, so you can't be a member already at Rise to do this. You have to be someone who's not a member and someone who is not a patient of mine. So someone that has never worked with either of us. We're going to do a giveaway for you. You must leave us a review, and you must follow both of us on Instagram, and then we will choose a winner. So what are you going to give away?
Ooh. Let me think on that for a minute. We got a lot of good swag here. Even do a free session. Come in, work with me for an hour. Let's do that. Come in. Our giveaway will be out. Come in and work for me for an hour. We'll come up with a good time. We'll get a time, and I'll take you through what I take our athletes through.
Sounds great. And so you want it to be a youth athlete? Can't be an adult?
Anybody. I'll take you through what I put through anybody. I'll take you through an hour of barbell training with safe and effective technique.
Okay. And I'll add to that. I'll come in for that session. So you'll have Dawson looking at you, and you'll have me looking at you, and then we'll set you up for success. So I like it. We'll do that. So those of you who are listening and you're not a patient of mine right now, and you're not a member at Rise, take advantage of this opportunity and continue to follow us. And if you have any ideas on interviews or content, just let me know and we'll get it set up for you. Thanks for joining us today, Dawson.
Colton.
Absolutely.
Have a good one.